This is the story of Kirk and a very bad case of necrotizing fasciitis. This is Kirk. One day, he got the idea that the time had arrived to purchase a big boy tool cabinet. He had always wanted one, and his birthday was near, so this would be his gift to himself. He went to the local tool store and bought a shiny red tool cabinet. As the cabinet weighed nearly 200 pounds, he had his wife Paula help him unload the tool cabinet into the garage. It was during the process of unloading when Kirk felt a distinct pain in his butt. While it did hurt, he didn't think much of it and figured it would pass. He couldn't have been more wrong. When the pain persisted the next morning, Kirk figured he must have a hemorrhoid. Over the next week, he struggled going to work, calling in sick about half the time, as the pain just progressively got worse and worse. He convinced himself that if he could just make it to his pre-scheduled vacation, things would heal and be back to normal soon. At the end of the first week, with no relief in sight, Kirk finally said to Paula those words which every woman wants to hear. "Honey, can you look at my butt?" Paula obliged and said there was an area near the anus that was red and angry. Over the course of the week or so, Kirk tried ointment after ointment in an attempt to find relief, but the pain only worsened. Paula continued checking in on Kirk's butt, assisting with the application of the various ointments and astringents. With the pain only worsening, Kirk finally gave up, called the doctor on Wednesday, and made an appointment to have his butt seen by a professional on Friday. On Thursday, a day before the appointment, Paula looked at Kirk's butt and said, "Something has changed." She told Kirk that the area was no longer red, but instead was black. Kirk took his temperature and found that he had a fever. Kirk knew this meant infection, and that waiting to go to the doctor on Friday was no longer an option. It was time to head to the local emergency room. He hastily packed an overnight bag, and off they went. The nice folks at the emergency room were rattled by Kirk's condition. They went into a furious pace, starting IVs, drawing blood, giving antibiotics, and finally providing some relief with very strong pain medicine. He learned that his blood pressure was dangerously low, and they started pumping him full of fluids as well, and inserted a urinary catheter. Ouch. They determined his case was severe enough that he needed to be at a larger medical center. Arrangements were made to ship Kirk out to UC San Francisco Hospital. Upon consultation with the surgeons at UCSF, the ER doc cut Kirk's butt open to relieve the pressure from the bacterial infection. So off he went on his belly at 2 a.m. in an ambulance to San Francisco. Apparently it was serious enough to warrant both a paramedic and a nurse in the back. Kirk started to think this might be more than an overnight stay in the hospital. The only thing that made the trip tolerable was the high-potency pain medication he continued to receive. Upon arrival at UC San Francisco, there was a frenzy of activity. Kirk was directly admitted into their intensive care unit, and a whole lot of people swarmed around him, asking various questions and then disappearing. Finally, someone appeared who identified himself as a surgeon and explained to Kirk what was ahead. He said that infections like this are quite serious, and they weren't sure exactly what they would find when they went in. It was going to be a bit exploratory, removing dead tissue as they went. He said things could be different for Kirk when he woke up, indicating the possibility of a colostomy, urostomy, and a partial removal of the scrotum. He also indicated the possibility of death. None of this sounded very good, and Kirk for the first time really began to feel the gravity of the situation. He was in septic shock, facing a potentially disfiguring operation that could also kill him. He had very little time before the surgery and called his wife to deliver the news as she was on her way to San Francisco, but wouldn't be there in time to see him before the surgery. The next few days were a blur to Kirk. He had the first surgery, then another surgery the following day, and a third surgery 2 days after that. The good news was that neither the rectum nor urethra were involved in the infection, so no external waste collection bags were needed. Apparently, the infection had tunneled nearly to the pelvis and was only a centimeter or two from the rectum and urethra. Interestingly, the surgeon described the amount of dead tissue removed as equivalent to 2 large scoops of ice cream. Kirk wondered why this term was used, and not something like oranges or baseballs. Maybe the doctor thought a fat guy could best understand things in terms of ice cream? Weird. The ICU stay saw the insertion of IV lines through the jugular vein and also a central arterial line. It took considerable effort to get Kirk's blood pressure back within normal range. After 5 days in intensive care, Kirk was finally stable enough and was transferred to acute care. Nurses and doctors worked to stabilize him after the bout of sepsis and started the process to heal the large surgical wound that Kirk now had on his perineum. What Kirk didn't know until this point is that some wounds, rather than being stitched closed, are left open, packed with a dressing, and left to drain and heal over time. The hospital care was really great, with only 2 incidents worthy of mentioning. The first was the discovery that Kirk is allergic to the main ingredient in the wipes used to give a patient a bed bath, resulting in a severe skin reaction. The second incident was when a nurse accidentally removed a urinary catheter without remembering to deflate the balloon first. Kirk's screams could be heard throughout the greater Bay Area. Another discovery was that, for whatever reason, Kirk's scrotum had swollen to about 3 times its normal size, making sitting extremely painful. After 2 weeks in the hospital, Kirk was stable enough for discharge and strong enough to get himself out of bed to use the toilet or get to the wheelchair. Unfortunately, the powers that be felt he needed time in a rehabilitation facility prior to going home. A suitable facility was found in the Sacramento area, chosen due to its proximity to family, and Kirk was to be sent there. For reasons unclear to anyone, it was determined that an ambulance transport would not be covered by insurance, and as such, Paula transported Kirk in the family car. And because discharge occurred at 5 p.m. on a Friday night, the transport took over 4 hours given Bay Area traffic. 4 excruciating hours. The rehabilitation facility was typical in that it was overcrowded, understaffed, loud, poorly ventilated, and smelled bad. Instead of the private room Kirk had in the hospital, he now shared a smaller room with 2 other gentlemen, one of which was hard of hearing and didn't sleep well, which meant a blaring television nearly around the clock. The food was horrid, but Kirk's family was nearby, and as such he convinced them to bring him meals from the outside. There were some great staff at the facility, but the staffing levels were so low it was difficult to get assistance, and Kirk knew the best rehabilitation he could get would be at home. Paula left Sacramento to return home and ready the house to receive a mostly bedridden patient. Kirk pushed hard with physical and occupational therapy and was able to discharge from rehab in a week. With a 6+ hour transport ahead of him, he enlisted the help of his parents, who had a recreational vehicle. Provisions were made so he could ride lying down. He arrived home Friday night after about 7 hours on the road. He was now Paula's problem. The first few days were brutal. The powerful pain medications made Kirk, well, we'll just say difficult. And the physical work for Paula was also grueling. Between wound care, personal care, cooking, laundry, and managing medical appointments, Paula was exhausted. With help from friends and family, things finally fell into place and a routine was established. A home health nurse came every week to evaluate the wound and measure the progress, sometimes changing the wound care procedures as the wound evolved over time. One key measure was wound depth, which was 12 centimeters when first measured at home and gradually decreased over time. As Kirk continued to heal, he began to go stir-crazy, wanting to go back to work, on vacation, or even just on a normal shopping outing. But with a large open wound, the doctor deemed the infection risk too high, so Kirk remained at home, cut off from civilization except for monthly doctor's visits. Given that he has used up all of his sick time and vacation time, Kirk is anxious to go back to work and hopes to convince his doctor that he can mitigate the infection risk for a return to work in February. Time will tell. 5 months off work is a very long time, but considering how close he came to death, it's pretty short in the grand scheme of things. Many aren't as lucky as Kirk, as a full 30% of people that get this kind of infection do die from it. That's a lot of destruction for one little bug.